Asthma and chronic obstructive pulmonary disease are obstructive airway illnesses manifested with chronic inflammation affecting the entire respiratory tract. Asthma is recognized as an allergic disease usually developing in childhood due to smoke exposure, infections, genetic susceptibility, low birth weight, and nutritional deficiencies. Asthma is characterized by reversible airflow obstruction following anti-inflammatory treatment. COPD is typically caused by tobacco smoking, developing after the fourth decade of life, characterized by airflow obstruction, resulting in progressive decline in lung function and premature death. Bronchial hyperresponsiveness is the exaggerated response to a variety of stimuli causing bronchospasm. In patients with asthma or COPD, bronchospasms can be induced by stimuli such as pets, pollen, fungus, dust, strong odors, chemicals, cold air, stress, pollution, and exercise. The prevalence of asthma and COPD increases with associated risk factors such as gender, age, BMI, infections, smoking, allergies, pollutions, and environmental toxins. These risk factors can provoke symptoms of wheezing, chronic cough, and declining FEV1, leading to accelerated loss of lung function while exacerbating bronchospasm symptoms. Asthma and COPD commonly overlap due to many common risk factors. Childhood exposures developing into asthma and bronchospasms may predispose patients to COPD later in life. Smoking cessation, oxygen supplementation, pulmonary rehabilitation, and vaccines are all therapeutic interventions for asthma and COPD. A symptom-targeted approach for dynamic obstruction can be relieved with bronchodilators, where inhaled corticosteroids can relieve bronchospasms. Adjunctive treatments such as antagonists, inhibitors, and other pulmonary medications should be administered by a specialist. Although COPD and asthma do not directly affect the mouth and teeth, medications used to manage associated symptoms can contribute to an increased risk of oral disease. Oral manifestations may include xerostomia, increased risk and prevalence of dental caries, enamel erosion, periodontitis, and gingivitis, unpleasant taste, low oral pH, oral candidiasis, and rarely Stevens-Johnson syndrome, constituting a medical emergency. General characteristics may include symptoms such as chronic cough with mucus, shortness of breath, voice impairment, dry mouth, tongue enlargement, gastroesophageal reflux, pulmonary hypertension, peripheral edema, heart failure, and throat irritation. Non-pulmonary conditions may also arise, such as weight loss, muscle wasting, cardiovascular disease, hypertension, anemia, osteoporosis, and depression. COPD is estimated to affect up to 2.6 million Canadians aged 35 to 79 years old, with 50% or more of these persons being undiagnosed. It is the fourth leading cause of death in Canada. While there is no cure for COPD, the disease can be managed with medications, immunizations, and pulmonary rehabilitation. Avoidance of pulmonary irritants improves symptomology and decreases mortality.